I call her my honey, honey. I don't want nobody to adorn your mommy and tell me why. This is Nanaya, the one and only Man Year One, and you're watching Breakfast Daily on City TV.
Good morning, Ghana. Good morning, world. You're in tune to the Breakfast Daily on City TV. Stoneboy says so. Keep it locked. Don't log off. Beep.
Welcome back. This is Breakfast Daily on City TV. Thank you so much for being with us. Now, every Tuesday we talk about your health. So if you have any questions, make sure you use the hashtag Breakfast Daily and the WhatsApp line 0550-585-832, and I'll be sure to ask the doctor. Now, today the topic we're discussing is hernia, and we've been joined by Dr. Kelvin Owusu, who is the medical director of Optimic Care Diagnostics. So he's going to tell us about hernia symptoms, how to treat it, and hopefully how to avoid getting it as well. Good morning, doctor.
Good morning.
How are you?
I'm very well, and how are you?
Good, I'm good. It's always a pleasure to have you here
Yes,
with
it
us.
is. It's good to be here. I like the view.
Thank you. It does wonders for your soul.
I know.
Now, what is hernia?
Well, basically, a hernia is a protrusion of abdominal contents outside of its boundaries.
Can you say that in English?
So the abdomen is the area between the chest and the groin.
Okay.
So you have the stomach, the intestine, you have the bladder, in the woman you have the uterus. All those things form parts of the entire abdominal cavity. Of course, you have the pelvis, which is below the navel line, you know. And when it comes to a hernia, any of these contents can actually sort of bulge, so you can actually see it on you say English,
skin.
so your stomach. You know,
Okay,
you can see it
stomach.
on your stomach.
Okay.
You know, so you can have that bulge, but it's not only an external bulge. Sometimes it can also happen internally.
Are you able to feel it if it's internal?
If it's internal, you may not be able to feel it, but then based on the symptoms, then you know. I mean, the doctor will suspect that something is going on, and then they'll request a couple of investigations to confirm that this is actually what it is, and then the next actions to be taken.
But before I meet the doctor, how would I be able to tell if I have an internal bulge?
If it's internal, most of the time you really cannot tell. It's based on the symptoms. So you describe the symptoms, and the doctor would say, "I think you have a hernia of sorts." And the most common internal hernia is called a hiatus hernia.
Hiatus
Yes,
hernia.
and it's usually the stomach, you know, kind of shifts up.
Ooh.
You know, so you have the esophagus, which connects to the stomach. When you swallow food, it goes through your esophagus into your stomach.
Okay.
Now the esophagus ends somewhere around the diaphragm. Sometimes in some people, the stomach can come above the diaphragm.
Wow.
So then a portion of the stomach is up. The diaphragm is supposed to be like a valve which closes the stomach. Now if the stomach is above the diaphragm, then it cannot be closed.
Wow.
So some people would have symptoms like heartburns.
So if it's not closed, that means the food from the...
Yes.
Is it
From the
esophagus?
stomach, yes, from the esophagus into
So
the stomach.
the stomach will just spill out.
It can spill back up into the esophagus, and that can be uncomfortable because
And it'll
there's
come
acid.
out
Yes,
through
there's
your
acid in
mouth.
the stomach.
Okay.
So when the acid sort of comes into the esophagus, it irritates the esophagus. So that's what we call most people describe as
Heartburn.
heartburns.
Okay.
Yes.
And you're
and
just
so
burping a lot.
you can be burping a lot, especially when you lie flat. When you lie on the bed, you notice that the heartburn symptoms increase. So that could be a sign that there's a possible hiatus hernia. Of course, there are other symptoms as well, but that's usually the commonest presenting symptom
What are the other symptoms?
of the hiatus hernia.
Yes, please.
Well, so if
How many types of hernias do we have?
with respect to the hiatus hernia, there are two types.
Okay.
But hernias in general, there are multiple types.
Wow.
So the commonest type of hernia is actually an inguinal hernia.
Inguinal.
Inguinal hernia.
What's inguinal?
And this is most common in males. So the inguinal region is actually that line where the thigh meets the abdomen. That line is the inguinal region.
Okay.
So most common hernias in men will occur along that line.
Wow.
And it's because there's a natural inborn weakness.
Oh, so we're looking at the picture here.
Okay, so these are the different types of hernias that you see on the skin. So we have the inguinal hernia, which is a bit cut off, but that line where the thigh meets the abdomen, that's where you have the inguinal hernia occurring. And I was saying that is because there's a natural weakness at that particular point. So abdominal content can actually come through there. Now, when I say abdominal content, it could be just fat. It could be intestine itself can actually come out through there.
The large or small?
It could be any of them.
Wow.
And it could also be something called, well, it could also be fluid, you know, and so anything in the abdomen, sometimes you can actually have the bladder also protruding through, you know, so it depends on how big that opening is. And there are things that you as a person can do that would lead to a widening of that opening.
What kinds of things?
Okay, so now the most common thing that causes a widening is actually heavy lifting.
So the people who go to the gym and they're trying to get buffed.
That's one.
Wow.
Also, manual workers who do a lot of heavy lifting. So masons lifting concrete blocks. If you do it every year, so any form of manual labor can actually cause an increase in pressure. Anything that causes an increase in pressure in the abdomen can widen that opening. In women, pregnancy can also cause a wide. Well, pregnancy increases the pressure because you have a baby growing, sitting in that space. So with the weight of that baby will, you know, sort of push down a lot of pressure, and that pressure can actually widen that space.
What about fibroid?
It can also cause that. Even constipation can cause an increase. So if
it can be that big, can it?
It can.
Any pressure?
If you're having a constant, regular or frequent constipation, you could, once you are straining,
wow.
If you are straining quite often, you could widen that opening, and then that could lead to a hernia. Also, so constipation on one side, diarrhea also can cause that because sometimes
you're releasing. So
yes, but sometimes you go and sit on the stool, and it's you have to strain to sort of get exactly. So anything that constantly causes an increase in abdominal pressure can result in an increase in that space, which would then push the abdominal contents out. And then I'm sure on the picture you saw the umbilical hernia, the navel.
Yes,
so
the one that looks like a belly button.
Exactly. So a lot of children actually have that. So you realize that their navel is kind of big. And
okay, so that's what we're looking at now.
Yes, so we tease them a lot and all that. It's actually a form of hernia.
Wow. So the kids were like big belly button.
Yes, belly button.
Wow.
That's actually a form of hernia. But the good thing is that for most people, as you grow older, it sort of takes care of itself.
How?
Well, the body, I mean, you as you grow older, everything sort of evens out, so there's not that big an opening to for abdominal content to come out. Of course, for some people, it still stays like that, and they may require surgery to close that space so that it's more pleasing to the eye, you know. And then we have the femoral hernia. So I mentioned that the inguinal hernia is more common in men. The femoral hernia is more common in women. So the femoral hernia.
Femoral?
Femoral, you know, the thigh, the medical term for the thigh is femoral area.
Femoral area.
So we have the femur. The thigh bone is called femur.
Okay.
So that whole area is the femoral region. So we have the femoral artery, femoral nerve, etc., etc.
Okay.
So a hernia occurring in that region will also be called a femoral hernia.
So for a woman, it happens in your thigh.
Yes.
And for a man, it happens
in that line.
In that line.
In that line.
Okay.
So those are the two. So even though the mechanism is about the same, increased pressure will cause the abdominal content to come out, but the men tend to get the inguinal, and the women tend to get the femoral. Of course, there are other types of hernia that are, should I call it, man-made. So let's assume that you've had a surgery before.
Yes.
Sometimes, if the healing process doesn't go smoothly, there can be a bit of an opening, and then the abdominal content can come out through there. It can be distressing, especially for the women, because you don't want to have you wear a bikini and all that, and then you have this bulge sitting there. It's not nice.
But men also wear bikinis, no?
Oh, well, I don't know. Maybe Spiky does.
You don't wear bikinis. Okay, back to the point.
Back to the point. So as I was saying, so well, some men would also be concerned, and so if it's big, then you have to close it. I mean, so have a revision surgery to sort of fix the opening. But most surgeries don't have that problem. But a few of the, you see, the thing is, once you interfere with the normal anatomy, anatomy simply means architecture.
That's why it's the anatomy and physiology.
Exactly. Exactly.
That one I know.
So once you interfere with the normal anatomy, the healing process does not or will not get you to 100% of what it was before.
Okay.
You know, and so if you indulge in this heavy lifting too early, so sometimes after a cesarean section, your doctor might say, don't do any heavy lifting for 6 months, 1 year, depending on the peculiar situation. If you do not listen to the advice and you indulge in these things too early, you put too much pressure on the scar, and so the scar might break. and then there's a hole there where the abdominal contents will come out. Of course, not going to come out, because the skin is still intact, but then behind the skin, there are several layers which can have a bit of a problem, and then the hernia would occur there.
Is there a way to prevent it?
Well, for one thing, you have to listen to your doctor's advice, because after every surgery, especially in the abdominal region, they will let you know the duration of rest. So some would say, 2 weeks, 1 year, depending on what kind of surgery, how major it was. And so that's the first. And if you listen to the doctor's advice, it will allow that place to heal very, very well, so that there's not going to be any opening to allow the abdominal content to come out. Of course, there's the element of infection. Sometimes you may have followed the instruction, but there may have been a bit of an infection, which would cause the scar to break down and then eventually lead to the hernia occurring. That may not have been your fault, but the thing is, once it happens, it can be revised or it can be fixed. So you just have to report back to hospital. But sometimes a lot of people do not go back to hospital, and then
what do you mean fixed? Is your doctor will now take your intestine and shove it back where it's supposed to be?
Yes, actually. I mean, that's the summary of the whole thing.
Wow.
So whatever it is that is out of place has to be put back where it is. Now, the thing is,
how dangerous is that surgery?
Okay, so that's what I was going to get to. For most hernias, most people don't really do much about it because it's not causing them any problems, but having said that, it's not really about the size of the hernia. You can have a very small hernia that is actually causing so much damage. You can have a large hernia that is not doing anything. So every case must be taken on its own merit. Okay. You have to report to hospital, and then the appropriate thing will be done. Some of them, they for example, some children, the old people have ways of dealing with them. They will tie a coin on the
coin.
Yes, actually, they do some things like that. They will tie a coin.
Safe?
Well, they say it works. So.
Wow.
So like to try and prevent the pressure from building up, because if the coin is sitting there, even if you increase the pressure in the stomach, it's not going to push the coin away. So then the opening does not increase. Those who go to the gym use a similar mechanism. So you notice that they have the weightlifting belt. Yeah. It's a similar mechanism. They reinforce the inguinal region so that when they lift the weight, the pressure builds up. It does not cause an opening of that already weak spot.
What about waist trainers?
Well, waist trainers, should I say the jury is a bit 50-50 on the waist trainers.
Why?
Well, some say it's definitely not good. Others say it's very, very good. So
what do you say? You're the doctor.
I should say I'm still undecided about this waist trainers.
You can't be undecided. You're the doctor.
Whenever there are two schools of thought, you're allowed to be undecided.
No, if I'm your patient and I'm thinking about using a waist trainer to prevent my hernia, because I see the men with their own male version. No, but would it work?
You see, a waist trainer is not. If you're using a waist trainer because you have maybe a weakness, maybe you've had surgery and you want to prevent that thing, I guess we can make room for that. But if you're using a waist trainer to sort of avoid doing the work that's required, that's a bit of a, because the issue will still be there. Once you take it off, I mean, things are going to fall out of place again.
Come on, doc. We're talking about hernia here. We're using it to make sure things don't come
that's
out.
Fine. So I mean, having said that, there are all sorts of gadgets to try. So if you have a midline weakness, there are material or there are belts you can use to sort of reinforce that particular place when you are doing physical activity. So there are so many things. You need to know, and this is why you have to go to hospital, so you know exactly what the problem is, and then the right interventions can be put in place.
How expensive is the test? Like if I want to go get tested, and is it painful at all? Like if I
to test for a hernia?
Yeah.
Oh, it's not really expensive. I mean, the regular consultation fee will take care of, because it's part of the physical examination. So the simplest way to test for a hernia is ask the person to cough. Okay. And then you observe, and if there's a hernia, most of the time when they cough, it will protrude. Wow. And then you'd see that, okay, that's where the problem is, and then you can focus on that particular place. In the more complicated cases, you may have to do further investigation to find out, but most people don't require those investigations. Okay. And I was saying that, so you can, people, you see, Ghanaians like to wait for pain. Yeah. Even though pain is one of the symptoms of a hernia, it's not usual. Most of the time, by the time you notice pain, it's quite, serious.
So how else should I be able to tell?
So
Aside the thing we've talked about with the heartburn, right?
So the easiest would be the protrusion. You see a protrusion on your abdomen or your back or wherever it is the problem is. You actually see it. So once you see that there's something abnormal happening here, you have to go and have it checked out. Don't wait for it to get painful, or don't wait for it to get bigger. But having said that, inguinal hernias in particular can get very, very big. I mean, it can actually, so there are funny stories you hear all the time that the person's intestine is inside the scrotum. It's actually possible. So you can actually have the intestine, and the intestines are very, very long. I mean, we are talking about meters upon meters. It can actually all descend into the scrotum, and now the scrotum becomes so big, and the guy has to literally support it with you know, it can be very, very disheartening. Now, most hernias, when it comes out, you can actually push it back in. So, you know, some
But the doctor will do that.
No, you yourself can do it.
You can just...
Yeah, push it back in.
But you need guidance, because you might push it the wrong way.
People know themselves, so they know how they push it back. Now...
But if I don't know, and I just see something, I can't just
you have to report, because you don't know.
Okay, that's
But people, those who have lived with it for a while, they know how to handle it, so they push it back. Now, I'm bringing this up because sometimes it gets stuck. Once it gets stuck, it's an emergency. You have to report at the hospital. You know, because like I said, some people like to delay until it's too late. Once it gets stuck, don't wait any longer. You have to report to hospital immediately. Because if it gets stuck and then it gets painful, then it means that your intestine is actually, for lack of a better word, is dying.
Wow.
You know, it's becoming strangulated. That's actually a death warrant.
Whoa.
You know, so you have to report at the hospital immediately. Don't wait. Once it's stuck, don't wait for the pain. Report immediately. Okay. Because that means you need emergency surgery.
Wow.
You know, and of course, emergency surgery is more dangerous than elective surgery. Elective is when you've come, you are not in danger, and then we take our time and do everything correctly. When you come in an emergency, everything is rush, so it's more dangerous. So if it's possible to do it without having to go to an emergency operation, do it. You know. And having said that, when it comes to treating hernias, there is no medication that can cure a hernia.
There is no medication that can cure.
You cannot take any medicine
hernia
by mouth to cure a hernia.
So how do you cure it?
Surgery.
Wow.
If there's a need to do something about it, it's going to be surgery.
Okay.
You understand? I mean, and this is very, very important, because you have people who come and tell you that I'm taking this medicine, or you hear adverts about this medicine cures hernia.
It won't work.
Hernia, it's kind of like, it's how do I describe it? So, I don't even know how to describe it.
It's like you have a headache. If something has fallen out, then you need to put it back in. Right?
Exactly.
So it's not necessarily something
because there's a hole.
curing.
There's a hole
you
over
have to
there.
Fix the hole.
And the thing is coming out. I don't know. You can't take medicine to go and bring it back and fix the hole. No, the hole needs to be closed with either, I mean, a mesh or suture. Something has to be closed before to prevent the protrusion of the
So once it's
abdominal
closed,
content.
it won't open again, right?
Never say never. If it's closed and everything is okay, it will not open again. But if it's closed and, for instance, you go back to your heavy lifting too early,
then you get it.
Then you get it. If you are going to the gym and you don't wear your belt and you're going to lift 20 kilos, 50 kilos, and you are going to get a hernia, you know, and so you have to take precautions.
Okay.
Whether you have a hernia or not, you need to take precautions. There's a right way to lift weight, and there's a wrong way to lift weight. And it's not just going to affect it's not just going to create a hernia. You can affect your back. It can cause a lot of damage for your own body. So heavy lifting must be done appropriately with the right support, so that you protect yourself from developing these things. Because I mean, surgery is surgery. Once you're cutting the person, it might not necessarily lead to your death, but it could, you know, have a negative impact. So if it's avoided, if it can be avoided, then avoid it. But if it's already established, then surgery is the only way to cure it.
Okay, so Bra Real from Cape Coast has a question. He says, please, I want to know whether too much erection can cause hernia.
No, too much erection will not cause a hernia.
Okay, so there's no time limit to erection.
No.
Okay.
I mean, erections has its own thing, but not related to hernia.
Okay, so you won't get it.
No.
What other things?
However, if you have a huge inguinal hernia sitting in your scrotum, it's possible that your penis will get lost in the hernia.
So you won't see it?
You can't see it, because the skin is a continuous skin that goes around the penis, around the scrotum. Now, if that scrotum has become so big, obviously, it's going to drag your penis inside, so you will not be having sex. I don't see how you'll be having sex in the first place.
Wow.
So we have to fix the hernia first,
before
and then you can exactly.
Wow.
And having said that, again, if you have a hernia sitting inside your scrotum, you see the scrotum is hanging outside for a reason, to keep the appropriate temperature for the testicle to function, to produce the sperm and the hormones and all that. Now, when the intestine is sitting on top of that testicle, the heat is high. So if you leave it there for a long time, you could end up developing infertility as a result.
Wow.
So, I mean, point is, it's abnormal to walk about with a hernia. So fix it. That's
early
that's all.
detection
Early detection and
is key.
early correction.
Correction. Any last words for us?
Well, I would just like to say that it's curable, or rather, it's fixable. You know, so you shouldn't carry a hernia about like a status symbol. You know, once you have that hernia, fix it so that you can continue living your life normally. You know, and as much as possible, if you have to engage in heavy lifting, do it appropriately. And if you have a problem with your bowel movements, if you are having regular bouts of constipation, you need to find out what the problem is and then deal with it. And then one thing I didn't talk about is the fact that tumors, sometimes one of the first signs of a tumor is the development of a hernia. Yes, I forgot to mention it. So don't treat a hernia lightly. Once you see it, find out what's going on, because the tumor would also increase the pressure.
Yeah.
And so once you see a hernia, let's go and have all the appropriate checks done so that if indeed it was a tumor, then it can also be treated as well.
Thank you so much,
All right.
Dr. Kelvin Owusu, who is the medical director at Optimacare Diagnostics. Where can we follow you on social media?
Well, you can.
I hope you have a social media
Yes, we
account.
do. I mean, we have Optimacare on Diagnosis on Facebook and Twitter, and myself, Kelvin Owusu, on Facebook and Instagram as well.
You don't have Twitter yet?
I do, but I don't know why, I hardly go there.
So you're a Facebook
But
and
it's the same
Instagram
name,
guy.
Kelvin Owusu.
Kelvin Owusu. Thank you so much for being with us. It's always a pleasure
All right,
to
good to
have
be
you, and I
here.
hope we'll see you next week as well.
All right.
And I hope you've learned something. So it's a great birthday gift for Wilberforce, you know, especially with the whole, what is it, scrotum thing going inside, have to stick it back up. So if it's coming out, you learn how to like push it back and then you're fine. But the most important things that we discussed were that the minute you're getting a lot of abnormal heartburn, then you know that it's a signal that there's something wrong. If you see something on any part of your belly, don't look at it as a gift. It might be something dangerous, so you want to go see your doctor. Don't wait till you start to feel the pain. Go immediately, okay? And sometimes too, it's internal. So when you go to get your regular checkups, you can actually ask your doctor, hey, I hope you're checking for hernia because I don't want to get it. And you can die from it, right? And we don't want to die. We all want to be alive. So let's take our health seriously. Let's get the help we need. And of course, surgery is the only way. So if you hear any commercials that there's a drug that would treat hernia, do not take it seriously. Go see a doctor and get the surgery. Do not go anywhere. Breakfast Daily will be right back.
I know do them anything, yeah. She was saying, if you wish me far and go to hello. What's up, it's your Rockstar Kwame Eugene. Keep watching City TV Breakfast Daily. Don't go anywhere. Rockstar. Yeah.